As President of the European Society of Hypertension, you will be the chairman of a Congress to be held in Brescia in January. How is the agenda set?
Well, let me say first that hypertension is still number one cardiovascular risk factor in the world, and it is the leading cause of mortality and disability worldwide. It affects a large percentage of the population, 30–40% of the adult population, thus representing very important social, economic and health problem. Despite the extraordinary results that research in hypertension has obtained, they represent one of the most important success of modern medicine. We are still in the position that the control of blood pressure in the population is suboptimal. And this happens despite the fact that we have many drugs which are effective and well tolerated. So why we have still this large problem? There are several causes that may explain this relatively modest result and the importance of hypertension as a risk factor for cardiovascular disease. These include the relatively modest adherence to the antihypertensive treatment in the long term, the fact that treatment is not given at appropriate doses of drugs, the so-called medical inertia, and also by the fact that sometimes the treatment is not appropriate for that patients. So, of course, the European Society of Hypertension is strongly committed with this problem. It has been organized with the main goal of improving the control of blood pressure in the population. And in order to reach this goal, the Society has programmed structured educational activities. This is one of the most important activities during the year, an update on hypertension management. And in this meeting that, as you said, will be held at mid-January, we'll discuss several topics. Among the most important are, of course, the best approach for treatment according to global cardiovascular risk, and therefore the discussion on new cardiovascular risk factors, management of patients with associated risk factors, with associated diseases. One important topic is the management of blood pressure in children and adolescents, a topic that is becoming more and more important. And also the treatment according to gender, the treatment of hypertension in women. It would be important also to discuss epidemiology, how we may assess the epidemiological trend using the so-called big data, administrative data, other data obtained with modern technology. And information technology may be used also in order to improve the relation between the patient and the doctor, and hence the adherence to treatment. In addition, we'll discuss the new modern technologies that may permit the evaluation of organ damage even at a very early phase of the disease. We also will give special attention to the best blood pressure measurement, how this blood pressure measurement research is going on, the results of large meta-analysis, how low blood pressure should be reduced, particularly in special subgroups, for instance in the elderly, the residual risk that is detectable even after apparently optimal treatment, particularly in patients at high cardiovascular risk. We'll have also a discussion with one of our friends from China that will present the experience for blood pressure treatment in that country, in China, that is so linked to the activity of our societies.
And could we invite the physicians to join us at the Congress? So.
Yes, of course. We'll be particularly glad and honored to have many doctors, not only from Italy, of course, but from Western and Eastern Europe, in order to discuss these results and have the opportunity of improving the knowledge on the treatment of hypertension, and to have new ideas for further research, further knowledge of these topics, and particularly how we can implement all the results, very good results that we have obtained with this long time excellent research in the field of hypertension.